Well, this week we learned Justin Timberlake has been battling Lyme disease. The pop star just wrapped up a 15-month tour. He had not mentioned the Lyme disease until a post on social media yesterday.
In that post, Timberlake said the disease can be relentlessly debilitating, both mentally and physically. He described nerve pain, crazy fatigue, and sickness. He also said the joy of performing outweighs the fleeting stress his body has been feeling.
And Dr. Payal Kohli, our 9 News medical expert, is with us this afternoon to talk about a couple of recent celebrity health crises. So let's start with Justin Timberlake and Lyme disease. First and foremost, before we get into him, what is Lyme disease?
So Lyme disease is a chronic infection caused by a deer tick. We don't have as much here in Colorado, but back where I trained in Boston, it was very, very common. And so the tick attaches to your skin, sits there for 1 to 2 days, and you develop sort of like a flu-like illness.
Well, even with the disease, can you perform? Because he's been performing, all over Asia and Europe. There's been a lot of, speculation about these shows not being the best, but he has been performing.
Oh, absolutely. And that's what I want people to take away from this. This is not a life-threatening disease. It certainly can mimic something like long COVID, and that's what a lot of people describe as chronic Lyme. When you have Lyme disease, that turns into brain fog, fatigue, nerve pain. So there's sort of 3 different stages of it. The first stage is when you get that acute infection, like a flu. You get a rash, you get fatigue, you get joint pains. Most people recover, but they do need antibiotics during that stage. Some people will progress to more of a disseminated, where it starts to affect the heart and the nerves. But even some people who got treated with antibiotics will go on to have this kind of long Lyme, or chronic Lyme as it's called, which may be what Justin is describing.
Interesting. And I'm not discounting his symptoms by any means, but I do know that, people that have been diehard fans of his have gone to his recent tour over the past 15 months and felt like that wasn't the Justin that they grew up knowing and loving, because they felt his performances were not up to par. Some people have speculated substance abuse. I'm not saying that. I'm just calling it from what people have been stating. Do you think, both could be true, but do you think that maybe perhaps some of those symptoms, why he wasn't performing up to par, could have been attributed to Lyme disease?
It's possible, but I will say one thing. Having seen a lot of chronic Lyme when I lived in Boston and trained there, it is a very difficult diagnosis to make, because essentially it's months to years remote from the infection. So you're attributing an infection from this deer tick causing these symptoms a long time later. And the only way to tell that you even had that infection is to check your antibodies. Now, if you layer on substance abuse, you layer on alcohol use, you layer on COVID potentially, I don't know if he's had COVID, but a lot of other factors that could lead to erratic behavior. It's hard to say necessarily it's that chronic Lyme that's causing his behaviors right now.
Interesting.